Okay, we'll call the meeting to order. Roll call, please.
Shelley Fayant. Anita Matt,
Present.
Sharmel Gillen,
Yes, Sukali.
Harold Langford, Glenn Tutti, Bing Matt, Ellie Bundy,
Present.
Mark Charlo,
Present.
Mike Dolson,
I'm here.
James Steele Senior.
Carol, could we have you lead us in a prayer, please?
Yes. Creator, today we just give you thanks for the day and ask you to watch over us as we take care of the issues of the tribal membership. And we also ask you to watch over the individuals who have recently lost loved ones, the Jesse Houle family and Bear Solois. And I know there's one other that I'm missing. Oh, Roger McClure and probably others. We just ask you to be with them at their families at this time and help them get through the difficult time they're going through. And Creator, we also ask for a prayer for our military and their families at this time, and also our first responders and ambulance. We just ask you to keep them in our prayers also, and anybody else who is suffering from COVID or illness and addiction. We just be with them, give them comfort, and show them the path that they need to get well. Komiate.
Thank you, Carol.
Mhm.
We have a set of minutes from September 14th.
Madam Chair,
Go ahead, Ellie.
I'd make the motion to approve the minutes of September 14th.
Got a motion by Ellie to approve the minutes, second by Martin. All those in favor? Unanimous? Oh, Carol's abstaining. Motion carries. Do we have any walk-ins, Jen? Okay. Council have any issues? Okay. Bing's got one. Martin,
And open.
open. Does any other council have any issues? Carol, is that an open? Okay. Okay. Looking for a motion to approve the agenda with the addition. Motion by Carol, second by Bing. All those in favor? Motion carries. Okay, Ruth. Yep. I think Jonathan and him are on, right? Jen? Okay, this is from pages 2 to 6. Good morning, Jonathan. I see Joe's coming on.
Sorry, I was having trouble with mute there. Thank you. Good morning to council.
Good morning.
Good morning, council. Morning, Jonathan. Are you seeing what page 2 on your screen?
Not as of yet.
I opened the file, Jen, but how do
I
I?
know you have to go on the bottom of your.
Sorry about that.
I see it now.
There it is.
Very good.
So, Joe, we talked this morning. I think Joe's going to discuss with you these discussion points on tribal health. If not, we have some other folks that can help. Joe, are you prepared?
I am.
Okay.
Um, is there a particular question, or Ruth, do you want to start the discussion?
Certainly. Thank you, Joe. I was responding to the request from Jennifer Trahan that council has a, I guess, an informing session that they needed that went to unpaid medical bills. I believe this was perhaps a case of a beneficiary who had unpaid medical bills and was becoming a collection issue for them. As far as paid care, what I put together, just a general background of the program for council that are not aware of the length of time we've been running this program under self-governance. So we've had 2 periods of operation. So I put together that background history just for those of you to be aware of how that's gone about since 1993. And then to look at how the program has been going since we took it back almost 5 years ago, December 1st, 2016. It's important to know the periods we ran the program because you will have folks, believe it or not, that are dealing with medical bills that are many years old. There's an important provision in Affordable Care Act that tried to address this problem that people were having with unpaid medical bills. In the case of Indian Health Service or us as a tribal contractor, if we've authorized the care, meaning you were given authorization for your services, then they typically will be held accountable for those charges, and that the providers cannot, under Affordable Care Act, legally seek recourse through collection on the patient. And so at the end of the packet, and we'll get into that in a minute. So it's really important to know, was the care authorized? If the patient went and sought service, got services without authorization, I don't know what the recourse would be. There's also going to be issues of the payer of last resort, folks who may have been eligible for a resource. And our system for paid care will hold up paying anything, even if authorized, until those payers pay. So you're going to have Medicare, Medicaid, private insurance, all playing into that. In the meantime, the patient, because of a lack of, can I finish? A lack of timely billing, will have probably received bills, and the length of time for that coordination of benefits is something. And I think Joe could speak to that a lot quicker. And the final thing is going to be whether the claim belongs even in tribal health's lap to begin with. If all of this occurred prior to us having the program, it's not for tribal health to resolve. It is for Indian Health at the Billings area to resolve.
Okay, Carol's got a question.
One quick question, Ruth. If this circumstance of the issue that happens and they don't notify tribal health, just because the seriousness of it or something, can that be appealed to be paid, or is that normally picked up?
That's the final point I was going to get to in the overall sense of appeal. And this is just really my question for tribal health. I obviously do not run the program. I'm just talking to you about the major provisions. So in the appeals process, if it's an IHS operated program, there's an appeals process spelled out in the federal regulations and also in the Indian Health Manual. But as a tribal contractor under self-governance, we have the option either to utilize that appeal process, or we just use our own, like through a tribal administrative procedures. So truthfully, I don't know if we're using ours. I don't believe, because of the way we negotiate our funding, that we're allowing IHS to play a role in appeal, because that would require us to leave some funds at the area level in case the director ruled that, yeah, you do have to pay. And so now we have to make that happen. So that's going to be in the case of, say you had a referral and IHS or the tribe denied it, said we're not going to give you services, and then you appealed. And then maybe in the meantime, you sought services and you're sitting there being billed for those, awaiting your appeal. But yeah, that's a process that could go all the way to the director of Indian Health if, it could go that far. So Joe, I guess I'm assuming and have assumed that we operate within tribal health system of appeal for either denials or the general operation of the program.
Correct. Madam Chair, if I could.
Go ahead, Joe.
To answer Carol's question, yes, there is an appeals process. If we are aware of the claim and the individual has reached out to us, or if they've received a denial from us, then yeah, the denial letters that we send out include instructions on how to appeal a decision for us. So short answer, yes, there is an appeals process. There is instructions with each denial we send on how to appeal that process. The first level of appeal goes to Rhonda's shop. I don't know if she's on, but often they can resolve those issues. Often it's a case of a lack of information that they just don't have to make a decision, and they can sort that out with that person once that contact is made. If Rhonda denies that, and that person wants to appeal Rhonda's decision, or then there's a secondary level of appeals, and our final appeals process, there's 3 levels, goes to the department head. So I made a short answer long, but yes, there's an appeals process. Those instructions are included in each letter sent to participants. If we're not aware of claims, often a person ends up in collection because the provider they have seen have not sent us the bill, or that individual has not sent us a bill. There's actually no denial from us for them to start that process. So often it's a case of us being made aware and provided a copy of those bills, and then we try to work with that individual to try to resolve those claims.
So, I have a question. At one time, I know when we were meeting down at Tribal Health, we discussed the, before Tribal Health took over from IHS, and there was a report at that time of how many bills were left. And I'm wondering if there's a way of reviewing that and seeing where we're at there of how many bills are delinquent and where they're sitting. So they could help the membership if they're still on that list.
Yeah, I believe we can make that request to IHS to see if they are still working some of that. I think Rhonda provides a monthly report identifying how many claims they received or requests, referral requests they received, how many they've denied, how many they've approved, and puts a number and a dollar amount to those approvals. So if I understand, you're trying to figure out what extent the backlog is still out there, Madam Chair.
Yes,
Yeah, so I think we can make that request to IHS to see how many of those are still kind of in process or stuck somewhere. We can certainly make that request.
Ellie?
Thanks,
Ellie?
Madam Vice Chair. Good morning, Ruth. Thank you for the discussion points listed there. That's helpful. Just a comment, I guess, with the issue that I brought up on the tribal member the other day who is finding himself in the situation of being docked 70 points on his credit score due to a bill that went to collections. I think a part of the problem may just be lack of communication then with members who are feeling like they're being told that the bills are going to be taken care of, and then that not happening. He did end up paying the bill. I want to say it was like $650, ending up paying it after it had went to collections. And so that was one example. I've since been notified of another example where a tribal member was approved and told that the bill would be paid, and it's in collections now. And so I guess it's just really frustrating when we're, trying to have good credit scores and do good things is, our credit scores are important. And if we're getting tribal members in trouble who aren't realizing, I guess, in some of these cases, it does seem like they're following up constantly and not getting callbacks or trying to ask the question, where's the status of this bill? I'm just thinking maybe communication then if nothing else needs to be improved.
Madam Chair.
Go ahead, Joe.
Councilwoman Bundy, I agree. I think I had an opportunity to look at maybe our website and the PRC program, and I have been working on kind of a service plan or an operating plan that we could share. We can certainly share that with you. It's in a draft form, and we can accept some of your comments or direction as far as how you want to present that. So we'll do that. Looking at the website, it was created when we first assumed the program. So we need to update that, provide some clearer direction, update the context on that. So yes, we can improve communications and improve the information we've made available to the membership on how the program works, how to access or get those referrals processed in a timely manner, and certainly what steps they can take if they start receiving bills. It's hard to generalize because each case can be unique. There are some providers out there who will not share the bill with us. They will send it directly to the patient. They are some providers won't accept tribal health patients at all because what they've told us is they're managing their payer mix. Some will not bill us at all, so we don't receive copies of those bills. But again, each circumstance is unique, and we can certainly improve or provide better information as to folks what the program does and how they might access to specialty care, or what steps they might take if they receive bills, and we'll take that on both through the website and just a general information that we'll share with you on the program.
Thank you.
Charmel,
Madam Chair.
Charmel, did you have something? Oh, I thought you had your hand up. Okay. Go ahead, Ruth.
Yes. Joe, could you include in the communication to Billings area the need to perform their reconciliation of claims under their administration for the fiscal years 15, 16, and October and November of the 2017 fiscal year? Because as I mentioned in the talking points, we've received their financial settlement as they see it of claims through fiscal 14. And this is another important point to know. If someone is coming before you maintaining they have a bill that's within that period or prior, in Billings area's mind, when they ran the program, they took care of it, meaning they're done with it. So that's going to be one that will be hard pressed to try to resolve. Again, receiving the true up of what they say they've reconciled until we took the program is pretty important, because that's probably going to affect people coming forward who may have been in these adverse situations. But the other side of that is some legal remedy. As I said, I crafted a letter some years back trying to help people resolve it. I don't know what success they were met with, but basically trying to wave them off, telling them you cannot legally do this. It violates the statute for the America Affordable Care Act. I'm thinking of American Rescue Plan. Affordable Care Act sought that protection on patients because this was a key provision that was particularly going to Indian beneficiaries. When we believe that Indian Health or a tribal contractor for Indian Health is paying the bills, that's what we're resting on. And uninsured Indians especially are going to, literally count on that, or Medicare beneficiaries that have not purchased Part B or the other additional coverage. They're really believing that this is going to happen. And so that was why that was put in that law. And perhaps Lana or other counsel from a legal department could assist tribal health in, helping beneficiaries who are finding themselves in that situation.
Thank you, Ruth. Go ahead, Ellie.
So for the two individuals that I have been speaking with now on this issue of being in collections, who can I have them speak to just to help, I guess, address their situation, status of their bill? One has been paid, one is not, and maybe what those steps are that they could do to try to fix the problem, if that's even possible, as you indicate, Ruth.
Madam Chair, Councilwoman Bundy, they can reach out to me. I've helped folks both navigate an appeals process if that's necessary, if it's gotten to that point, or how we might route those claims. So they can certainly reach out to me.
Okay, I'm going to send you their names in the chat, and so you can expect those.
Okay.
Thank you, Joe.
Yep.
Okay, is there any other questions?
Yeah, Madam Chair.
Go ahead, Carol.
In this document, Ruth, you know, the money that was budgeted
Mhm.
and then the money that was expended. So that's the pool of money that's sitting there for anything else still to this day to pay. That's quite a chunk of money.
Yes,
Go ahead, Ruth.
Councilwoman Langford, it's, the nature of the way the program is operating is, first of all, as Mr. Durgalo alluded to, providers don't often bill as soon as the services
Yeah.
occur, and some of them take months or even up to a year, even longer. And so once the claims are submitted and Mr. Durgalo's program then adjudicates them through that FI process, there's, you know, again, even more potential for a delay. And so there is quite a bit of time between incurring that cost or obligating it. Today, Carol's going to go to the doctor, but it could be 9 months before the bill comes and is paid. So there's quite a lag time. It's not to infer, I don't think in any way that things weren't done. It's just that that's the time frames that is happening. And especially in the current year, and I think Joe could probably answer to that because I thought that was a bit below what I would have thought. But because as Billings area is demonstrating to us, it could take years to finally settle up all of these obligations. Paid care tends to take on pretty long, costly cases. These are people who have been in a hospital, have had a premature baby that was in NICU. I mean, it goes on and on. And so the time it takes to resolve and adjudicate every single claim, because every provider's billing, especially in a hospital charge, you have the hospital, you have the specialist, you have the, I mean, it's pretty involved. And so, you know, the case management of that is, you know, wholly on tribal health at that point. And not each and every episode of the care is going to be fully approved and billed and paid as, or paid as billed. It is not a job I would want to have to do myself or to be in charge of. So, but yeah, there is quite a balance of funds in paid care, Carol. That's a very correct observation. And due to that settlement of 8 million is why it's sitting quite a bit, you know, high because of that reconciliation amount that they had to pay us, and then more that we believe is forthcoming for those final years.
Okay, and is this just for the region or is this a CSKT
This, no,
only?
this is the tribes.
Oh,
This is
wow.
ours. The annual amount that's coming in for the program is about 12.5 million. And that's the amount that we place in the budget. We give them the entire amount. And if they were to request any from the reserve, we would certainly do that. And I would expect that in coming years, as they start catching up with the obligated to needing to be paid, we will increase it to what the need is.
And does Chef pick up some of these cases at all, or?
The
But
chef,
I really, that's our responsibility as
Yes,
a
it is.
tribe to apply.
yes, correct. And we do receive some chef reimbursement for the high cost cases. And again, that is funding that's going to be paid back to us through our funding agreement. And those amounts are made known to tribal health. They could request additional allocation for spending if they desired. They have not to this point.
It would be not, yeah, well, it'd be nice to know, but they have not done none yet. Is that what you just said?
No, they have not requested to be additionally supplemented in PRC
Oh.
spending for that.
Madam Chair, if I could,
Go ahead, Joe.
maybe to add, in addition to Ruth's explanation about that balance of funds remaining, there's, I guess, other issues that might impact what's available. What that number doesn't reflect is care that has been approved but not provided yet. So we have also what we call an obligated balance. We approve a procedure with an outside provider. We'll estimate a cost to that. So we, I guess, reserve some funds to pay those procedures we've approved, but have not yet been provided or billed for. So there, I think I just looked at Rhonda's report, and there's about $4 million in approved care that has not been provided yet or billed for yet. So there's that. particular issue. And I forgot what the second issue was. but certainly the obligated amount is not reflected. I recall now. I'm getting old. The other issue is the that amount reflected in Ruth's report is the amount that has been processed through the tribe's accounting package.
Mhm.
There's I guess a separation between the FI checking account and the tribe's accounting package. So there's a reconciliation that we provide to the accounting department to correctly reflect what we've actually expensed or paid to date. So there's because the checking account checks are issued by the FI, that is not a checking account that I guess is attached to the tribe's accounting package. Those expenditures are done by a journal entry. We provide that information based on what was actually paid. So there's some delay there between the time we provide the actual expenditures and when accounting might make those journal entries in the accounting system. Healthcare is complicated.
Madam Chair.
Go ahead, Charmel.
Thank you, Madam Chair. And certainly thank you to all of you for this discussion. And I just wanted to ask a question or ask for some clarification. When this was brought up prior to this meeting being requested, I understood that there was concern for credit report that happened, a credit score, and we have heard this, in the past, and I know you guys hear it a lot. So I'm curious about how to alleviate that issue for tribal members. If a payment is not being made that previously was said to have been qualified through the PRC program, so it was approved, it went through the process, and yet there's balances owing. And I know that, sometimes when it push comes to shove, tribal members just pay those balances owed. So is it within your procedure right now, is there always a letter sent out to the tribal member and the provider saying that the procedure or the care has been authorized and that the tribe is taking responsibility? And if so, should tribal members hold on to those letters and provide those when they're being billed by a collection agency? Would that seem to be advisable?
Madam Chair, Rhonda, if you want to answer that particular question about approvals, do we provide, Charmel, if I'm correct, do we provide a written authorization and approval for them as part of their record? Rhonda, if you could answer that.
That's not a problem. So on the referrals that we receive, a letter goes out to the patient, and also a notification goes to the providers, and it goes to the referral coordinators at the providers, because they're the ones requesting it through their doctor's offices. So all of our notifications every Friday go to the providers that has been authorized for that week on referrals. And patients on Monday, the letters are generated and mailed out to the patients. It does help if they have it and they do provide it to them. But again, our issue is if we authorize you, just for an example, an MRI, you go to St. Pat's and you have it done. St. Pat's will bill us because they have the information, but the person that reads the MRI is Inland Imaging. They do not share information with each other with St. Pat's or with Inland Imaging. So Inland Imaging is unaware of anybody's insurances. That's why we always recommend when people get bills to send us a copy. Definitely call the provider to let them know their insurances, because again, they don't share the same billing system, so the information is not shared. Same thing goes with labs. If we authorize something for labs, same thing for anesthesiology. If you have approved surgery, they pay a different company, anesthesiology, to come in and provide that service, and they bill separate. Again, no one's insurance information is provided, and I'm not sure if it's a HIPAA or what it is, but whatever's done at the hospital, that information, insurance information, is not shared to the outside billers. Even if they have a doctor that comes in from Spokane to provide those services, we get the bill from Spokane, but they're unaware of the insurance. So we really highly recommend that patients, when they get those bills, to call immediately. Definitely send us a copy, because this way we can follow through. That's where a lot of things get missed. Is it was authorized, we paid the big bills because we see those, but we don't know who they're calling in to provide those services, or who's going to read the x-ray, or what anesthesiology. So to us, we do authorize it, but we do need assistance from the patients or the recipients to help us gather all the information before we get all the bills paid. And that's where some of them linger. And it is true. I've been working on a bill for, it's going on to 5 months. And they finally said they're going to send it to me. They finally billed the person's primary insurance. It's just kind of a process of dealing and also re-educating these providers what tribal health is, or / IHS is, because everybody keeps changing their billing system to, I'm not going to say a cheaper person doing it, but other people doing it, where we got to re-educate what we are, how to bill us. And it's just kind of been of a struggle. And I think it's this COVID, because a lot of people aren't doing it in-house anymore. They're sending it out. And so we are having those little gaps.
Thank you for that clarification. I just think that's really important for people to understand, and to know that you and your staff are there to advocate or help through that process. Thank you, Rhonda.
Martin?
Thank you, Madam Chair, and Jonathan and Joe and staff. So let's say they go through that whole process. They bring you all the bills. At that point, how do I, as a tribal member, know that that's going to get paid? Know that I can just not talk to the collection, or whatever place it is, because I think that's the issue here. Is like, we are told that things are going to get paid. We call, we send you the bill. Yes, those will get paid. So out of sight, out of mind, I forget about it. And then the next time I hear about it is when the collection agency is contacting me. That's the issue here. What goes on between us giving you a bill, and usually it's verbally, of course, because we're just calling, we finally got a hold of someone, and that happens. And then, like I said, the next time we hear about it is collection. As counsel, when we hear about it, same thing, and we got to take people's word at it. But this is from my experience. This has happened to me. Yes, I should have been on it and kept calling them and making sure it was getting paid, but we all have lives, and it doesn't always happen. And that actually prevented me from buying my first home, because that was on my credit. I thought it was paid, it wasn't. Thankfully, I got it taken care of. I'm sure I paid it myself because I wanted to buy a home. And we're doing this to tribal members, and that was 8 years ago, 9 years ago. And we're still getting these same complaints. And we're just hearing, oh, the client's got to do more. Oh, they got to do more. Oh, someone should help them with a lawyer, or someone should help them with this. Let's be proactive. Let's maybe create a credit division, like tribal, our tribal credit is doing. They're doing credit counseling. Why can't you have someone down there that's skilled in that can help people repair their credit after it's been affected by tribal health not paying a bill, or the BIA, taking too long, or whatever or COVID, whatever the excuse is. We basically just tell them, oh yeah, we'll pay it. And then the ding on the individual's credit score, that's just their problem. And that's not right. And this is an ongoing issue that needs to be addressed. Thank you.
Thank you, Martin. Ellie, did you have something?
No, I don't, thanks.
So if I could respond, Madam Chair. Can you hear me?
Yes, go ahead, Jonathan.
Thank you. To Councilman Charlo, we are working to set up some programs to help people in the community. We'll definitely take your direction in terms of the credit repair. And I think maybe we could even focus on the medical side, because we all had hospital bills, and 6 months later get a collections letter where we never even knew we were responsible for anything. It's such a mess. It's just horrible having come from that area. So what we'll do is we'll work with community health, where as we build the second division, by the way, which you'll get a full report on the 23rd. And we'll try to be more proactive. And when those come about, we won't just express to them what they should have done or, where they are. We'll try to help be more proactive on that side and solve those problems.
Jonathan, this is Nita. One of the things that I had thought about too, and it's kind of what Martin's alluding to. And I don't know that tribal health at one time didn't have someone, but kind of an advocate. There's quite a bit of the steps down there that are hard to get through. Not just the referrals and the bill paying, but it's confusing for people. So probably more education and maybe even a position of an advocate that they can go to and help step them through would sure be appreciated.
Absolutely. We're going to do one in every community through the new CHRs. We're hiring the 8 and they'll be trained for that. But we'll also try to look at a position that's stationary in the clinic, so maybe they can come in and get more guidance. We'll look at that as well. Thank you.
Thank you, Jonathan. Any other questions? Okay. Continue on, Jonathan.
Thank you. Are we moving to the agenda page 8 for Dr. Cahoon?
Good morning, everyone. So today,
Good morning, Jesse.
my formal council agenda request form is on page 7 of your packet. This is for the request for capital equipment purchase for a medication kiosk for the Ronan Tribal Health Clinic. We have these kiosks in Arlee and Elmo currently to, pretty good success, in addition to, being very popular among the patients that use them. On page 8, I go into more detail of how our current kiosks have been used. So when we look at like the Arlee kiosk, we've serviced, between the two, we've serviced over 250 patients and dispensed about 2,000 prescriptions out of those kiosks. They are wildly popular among those that use them. I am seeing some issues with the Ronan community being just perfectly in the middle of our 2 locations and them having difficulty getting their medications. We've tried to bridge that gap with still mailing to select patients in addition to delivering to their homes. But as you guys know, that's very time intensive. And then, with recent surges, we've had, more staff that have had to be go out with sick kids and things like that. So I just need to have a solution to help that community make sure that they get their meds on time and they can do it safely. I've worked with the folks that currently staff the tribal health clinic in Ronan, and they feel like this is a really good option to help those patients in that community. The cost of this kiosk will be coming out of THIP budget, so not out of our general budget. And truly, this is to help those highest populations, and then those who have transportation concerns getting to either the Polson or Mission Pharmacy. Like I said, we've worked with this company who makes this particular equipment in the past, and it's been, really, they've been really easy to work with and have really helped us get these things up and running rather quickly. I don't have a ton of information other than what is included in this packet on page 8. If you guys have any questions about this, please let me know.
Does anybody have any questions for Jesse? Martin?
Madam Chair, I'd make the motion to approve the capital expenditure report. Yeah, these are very successful. We actually use those out at Job Corps, and I think that might actually been one of the best things that we did. So having these be in the communities for people is a great thing. So thank you guys for doing this for Ronan.
Okay, so we have a motion by Martin, second by Bing. All those in favor? Unanimous with Len out of the room.
Madam Chair.
Oh, I'm sorry, go ahead.
Thank you. I don't know if that should have included authorization for non-competitive purchase, but I think that's the requested action.
Do you want to include that in your motion, Martin?
If it's truly necessary and the semantics of it are, yes, I'll include it. I guess that would be something for Jonathan or someone down there to answer.
May I respond, Madam Chair?
Yes, go ahead, Jonathan.
So the equipment, I'm sure, forgive me, but Dr. Cahoon, if I'm wrong, but we're trying to use the same equipment we're utilizing in all the other facilities and the current contracts with that. Is that correct, Dr. Cahoon?
I'm sorry, Jonathan, I think I'm not fully understanding what your question is. We're trying to use these in all of the communities. Yeah, so we piloted them in Elmo and our Lee, and then our next step is Ronan, and then, we're in process of trying to get a larger building in Hot Springs, and that's our next goal, is to get one there to service those patients, because we're having the same issue with delivery out there and having it be time intensive for our Polson staff.
Okay, so the procurement policy is requires approval for non-competitive purchase. So is that all right
moved,
to
Madam
include?
Chair. I already made the motion, but I will include that part in. Thank you.
That's all right with you, Ming? Okay, so noted. Okay, motion carries.
Thank you for your time today.
We needed a vote on that, Madam Chair.
I thought I'm sorry. I'm sorry. Yeah, okay. Everybody in favor? Okay, motion carries with Lynn out of the room. We got Gary. Are you there, Gary?
Yes, thank you, Madam Chair.
Morning.
What we have here to present is the continuance of our HVAC program. As we're all aware, we started this project many months ago. And unfortunately, as you can see before you on this document, a number of the items have gone up in price. And so we had the contractor break that down specifically so that we could see exactly what those items were. And so our request is permission to modify that contract to reflect the increase in the price of these materials.
Motion by Carol to approve the modification, second by Martin. All those in favor? Unanimous? Oh, hold on. Those, any opposed? Mike is opposed? And Lynn is out of the room. Motion carries. Go ahead, Carol.
I don't know if Rick is on or not, but I'm just wondering if these kind of actions should be something that we should still be handling. I mean, it's a modification, and if it's within, I don't know about a budget, but if the budget amount isn't over a certain amount, I think programs should be able to handle a modification. I know safety of dams, they're usually large, huge modifications and a large dollar amount. But when it comes to this, I don't know if we should hold up our programs when it comes to this kind of thing. Just a thought.
Okay.
Thank you.
Hey, thank you, Gary.
Thank you very much for your time.
Have a good day.
Thank you.
Okay, so I see Chelsea's on here and I believe she's going to give us an update on COVID.
Good morning, everyone. So yes, I'm here to give you an update on where Lake County and CSKT stands with COVID. Unfortunately, we are still receiving cases as of this morning, so I don't have up-to-date numbers. These are from yesterday. So we have had a total of 3,019 confirmed cases since we started the pandemic. 267 of those are active. Of those active cases, 61 have been vaccinated. We have 7 current hospitalizations. One of those hospitalizations has been vaccinated, and we've had a total of 46 deaths. And just a reminder that actually 8 of those deaths have happened since the end of July. Vaccination wise, our county is at about 57% fully vaccinated, and then 64% with 1 dose. The age group that is still lacking is the 12 to 17-year-olds. We're currently sitting at 64% of that age group not vaccinated. So 36% have received at least 1 dose. So we know that we have been now seeing cases out of the schools. And so just letting everybody know that those student cases are taking a priority right now. We want to make sure that we quickly identify students who are positive for COVID. We isolate them as soon as we can, and we do the contact tracing. And so for those who are not students, if you are positive, please be patient with us, as it's taking about 3 days for community health or the health department to notify and actually contact the positive individual. They should be contacted by the location that they got tested, asking them to isolate. And so that's what we're asking, just go ahead and isolate, and public health will contact you as soon as we're able, again, with that priority going to students. We do know that the Arley, Polson, and Ronan school boards met earlier this week, and they all voted down masking, mandatory masking in the schools. So as of right now, those schools are not masking. Let's see, we are utilizing our mobile unit to try to offer more testing opportunities. We were in Arley last week, and we had a very successful turnout rate. We were able to identify 10 cases. We are in Arley again today, And then looking for, we're planning on getting out on Monday. We don't have the schedule yet of where we'll be. But again, that will be on the Tribal Health Facebook page as soon as we know where we'll be on Monday. Tribal Health continues to do testing at the SKC site. We have increased our hours. So we're there Monday through Thursday from 8 to 5 and Fridays from 8 to noon. Currently, the demand is great for testing. We do have at-home test kits available. We have those in all of our clinics. However, the state is now running very short on those, and we are not going to be able to get more at this time. So what we have is what we have until further notice. Do you have any questions about all of that so far?
Yes, Martin's got one. Go ahead, Martin.
Thank you, Chelsea. Appreciate the update. I just wanted to, just because this is really interesting. You guys all saw today's, what's really interesting is looking at a year ago today. I shared this last night at my meeting, and these numbers are from the start of the pandemic. And, you know, look at that compared to, you know, today, which is, you know, just look at those back and forth. Think about all the people that aren't on this list that have COVID in our community, that have our, you know, COVID in the community north of us in Flathead County, south of us in Missoula County, to the east, you know, the west to us, Idaho is blowing up. And I really want to support our healthcare workers. You know, I sympathize with them because, you know, this is going on a long time of them dealing with this. And the saddest part for me is, you know, and I said this last night, I hate being redundant, but we should be done with this. You know, our case number is 200 plus more than it was a year ago. And we were thinking about shutting down then. And I'm not advocating for that, you know, but this flippant attitude towards COVID that is out there is getting us all in danger. That is impeding my right to freedom, my dad's right to freedom. You know, we're creating prisoners in their own houses because we won't put a mask on or we won't vaccinate. And, you know, I don't know what it's going to take if it's going to, you know, if I'm going to start going to school board meetings or whatever to support our tribal health and our public health people. Because, you know, people are complaining about, you know, us putting things on them. But the reality is we're looking at a nationwide probably shutdown, potentially. And then we'll have our local government fighting that. And, you know, I kind of explained the reason why I'm so passionate about this last night. If you so choose to look at that, go ahead. But this is so serious right now. You know, like sporting events right now. You know, look at the college level. We have hundreds of thousands of people in stadiums. Like they're advertising it as a selling point. You know, 110,000 at Penn State this weekend. You know, look at all the people that went to Seattle for that game. That stadium holds 80,000 people. Let's truly be a community and help our you know, our people on the front lines. You know, we talk all day about helping each other and being a community and these cultural ways and everything. And I know that our community has done a better job, but There are still people in our community spewing this garbage, and I'm going to start being very blunt about it. You know, this inaccurate garbage out there about this. And yes, everyone's entitled to their own opinion, but when you're spewing this garbage, it's influencing people to impede my right to freedom, then I'm going to call you out on it. And if that's something that, you know, in here the last few weeks, we've had people that are standing on these issues and they're standing on these things because it's the right thing to do. And it's distracted us from this very thing. You know, there's a lot of people out there that are guilty of this. And here, this body has been distracted for a month over some BS where people were standing on this issue of integrity and doing things that are right. And we spent a month on some other stupid, you know, it's not stupid, but it's things that we shouldn't be dealing with. We're in the middle of a pandemic and we're spending time on other things. You know, I apologize for taking your time, Chelsea, but the more I think about this, the more I live it, you know, the more that we all should be out here screaming from the mountaintops to protect our communities. You know, Chelsea said, what, 8 deaths in the last, since July? That number is only going to continue to climb. And I'm not going to stop. You know, I want to. I'm so tired of COVID. But people like Chelsea, people like Tammy Matt, all the frontline people that I can't think of right now, you know, our jobs are so easy compared to them. And we need to embrace that. We need to help them. And whether that means you guys going to school board meetings too, you know, as an Indian community, as a tribal community, as a reservation community, you know, we have local control here. If you influence our commissioners, you know, this has got to stop. And we're looking at another year of this. And we have the answer. Everyone wanted the silver bullet. We have it. If we could have got to herd immunity, we wouldn't be here. And we can do better, and we will do better. And I will, you know, make it my mission to do everything I can. And it's been that, but you know, this is my reaffirmation that you're going to hear about this from me until we're done. So thank you.
Thank you, Martin. And thank you, Chelsea. And
Madam
yes, go ahead.
I know that people have heard a lot of information about an upcoming booster shot, and I just wanted to touch on that really quick. So right now, people who are moderately to severely immunocompromised are eligible for what's called a third shot, and we have been actively giving those at the Tribal Health Pharmacy. The Biden administration announced a few weeks ago that the general population would likely be eligible for a booster shot. I just want to say that the FDA is going to meet on that tomorrow. The most recent data shows that we likely will not need a booster shot because the vaccine is still effective in preventing severe COVID and death. And so that's what the vaccine was invented for, to protect against severe disease, to protect against death, and it is still doing that. So we will know hopefully tomorrow whether the FDA is going to authorize a booster shot, and if they do, who that booster shot will be for. But I just want to caution everybody that it may not be as widespread as we had first heard from the Biden administration. And again, as soon as we know anything, we will update everyone on our Facebook page and let everyone know if it is authorized, how we will roll those out.
Go ahead, Bean.
Thank you, Madam Chair. Hey, Chelsea, those that had that Moderna vaccine, and now that Moderna is still working on getting a booster shot out there, do you have any idea when that's going to be ready, or do we have to, can we get a different booster after receiving the Moderna vaccine?
Sure. Well, what we do know right now is that from those people who are authorized to get the third shot, the FDA and the CDC have said, you know, you can get either Moderna or Pfizer as long as you're getting an mRNA vaccine. It doesn't matter necessarily which one you got first. You can get either of them, although they prefer you to stay with the same one. We do not know if the FDA authorizes a booster tomorrow. We don't know if they're going to follow that same guidance. We have to wait until they come out with that guidance and recommendation.
Any word on the Johnson & Johnson?
I have not heard anything about the Johnson & Johnson. Jesse, have you heard anything else?
No, I haven't. Their data is just a little bit further behind than the Pfizer and Moderna as far as watching people after receiving the initial doses. So we haven't heard any updates.
Okay, thank you.
Thank you.
Okay. Is that it then? Oh, I'm sorry, go ahead, Lynn.
Thank you, Madam Vice Chair and members of the council. One of the issues that we need to also stay focused on as we're moving back into the pandemic is the compensation for our employees, for our frontline, our essential worker employees who we still have yet to address from last year. We have put a lot of people's lives on the line for them to help continue on with the government operation, tribal operation here. And now that we have the resources to look at compensating them, and I think we need to look at that and address that as soon as possible. So if we do find ourselves in a situation again, at least we know that these people, we can show these people their worth when they continue to come to work and keeping our buildings clean and our frontline health workers and all the essential people. So just wanted to throw that out there and remind us all, and let's get that finished because we've been dragging on that one too long. All right, thank you.
Thank you, Lynn. I do appreciate that, and I hope that the other departments are looking at this coming up as well again. Is there anything else, Jonathan?
No, Madam Chair.
Well, thank you all. You have a great day. Stay safe. Okay, right now we've got 3 of the councilmen, and Arlene Adams was here. Arlene wanted to remind everybody that the closing ceremony today is at 4 o'clock, the Circle Up, and wish that to wish the students goodness and happiness with their closing prayer for the week. So she wanted to remind council of that. So thank you, Arlene. Sorry we didn't get you in when you were here.
Madam Chair, I'll be there.
Okay, thank you, Martin. Okay, Bing, do you want to bring up your issue?
Sure, thank you, Madam Chair. This morning on the way to work, I got a phone call from Kerry Doney. And he was wondering if he could get assistance for burial of his wife. She's a non-member and he wanted to know if there would be a possibility of getting that assistance to help him with the funeral. He said that he put in an application and he hasn't heard anything about it. And whoever he talked to said he had to bring it into council, but I don't think that happened yet. So just FYI, thank you.
Yeah, it'd be spouse. I'll have Jen follow up on that. Okay. So, Martin, did you have something you wanted in open?
Well, Madam Chair, I think I just did what I was planning on.
Okay.
I was going to talk about the numbers that are out there. Give me 1 second. I'll get the numbers that Chelsea just ran through. And actually I will. I think I've said what I was going to say. I just said it a little bit earlier than I planned.
Okay.
I just really think that we need to focus on what's truly important, and the health and wellness of our elders and our children and our immune compromised are what we should be focusing on. And let's continue to do that. Thank you.
Thank you, Martin. And Carol, you had something that you wanted in open?
Yeah, Madam Chair, Virginia Griffin, a longtime tribal attorney for CSKT, had passed away. And I failed to mention her name in the prayer this morning, but also wanted to ask council if we could consider some kind of a condolence letter to the family, or I don't know if she's going to have a service. I would like to go, but I'm not sure if there is one. I didn't see one in the paper this morning, and then also send flowers if that's possible. But she was here 25, 30 years, and was a wonderful person to work with, and just really enjoyed her abilities and her laughter and her knowledge. So just wanted to mention that.
Thank you, Carol. And Jen, maybe we can follow up on that. Send some flowers and condolences. Thank you. Okay, so we have got NRD, so let's take a 5-minute break. Oh, go ahead, Len.
Okay, thank you, Madam Vice Chair. I just wanted to let council know that through the Rocky Mountain Tribal Leaders Organization, we were invited to meet with Secretary of Interior Deb Haaland on September 29th. So that week I will be meeting with her on consultation on a couple issues, but one of the issues that I was planning on sneaking in was the Mission Valley Power issue. So I felt this was a good opportunity, and I will meet with our attorneys prior to and get some talking points.
Yeah.
And that's in Billings.
Excuse me?
I'm sorry, that's in Billings?
No, that'll be in Washington, DC.
Oh, okay, thank you.
Madam Chair.
Go ahead, Carol.
Len, were you at the meeting yesterday with Mission? Oh, okay. I would definitely get with Ryan or somebody and get filled in on that, because I'm not quite sure if we're at that step yet. So you might.
Well, what I was planning on doing was just having a brief discussion that this has been a historic endeavor for the tribes to try to acquire this, and we have begun discussions just to keep it on her radar, so she's aware that when it does come to her office, she's aware of it. So nothing really specifics. It's just kind of a reminder, and I felt this is, the tribes get they don't get opportunities like this to meet with cabinet officials. And so I thought this would be a good opportunity to bring that up.
Okay. Thank you, Lynn. Thank you, Carol. Okay, we'll go on a 5-minute break here and come back with natural resources. Anybody around?
You should shut off the live stream too. Like instead of using my little camera on the little that camera right there, does the whole- that should- I would just put it on there.
Oh, it's right there, is that one like above you?
Yeah.
Oh, I know for your next.
I know, man, this is gonna be so much better. Not that it was bad. Oh, yeah.
Well, see, the sun's there, almost there.
We'll take pictures of it. Our tribal council right there. I want to take a break, God.
Oh, you're the one that's.
Here. I know, but I think you guys need breaks too, man. No breaks for me.
It's on their job description
No.
as other duties assigned.
No rest for the wicked. Here, I'll put those up. How about that?
Call the meeting back to order. And we got Rich with a contract approval. Good morning, Rich.
Good morning, Madam Chair, members of the council. It is a beautiful morning. Just talking a little bit personal before I begin. I just wanted to just let the council know that my mother-in-law was facing some major health issues a couple weeks ago that weren't COVID related, but she had to get transported to Great Falls, Montana, because there was no facilities locally that could even take her due to the pandemic. So it's getting real. Anyway, let's move forward to what I'm here for. To talk to council about the approval of a contract with Dick Anderson Construction to initiate the construction phase of work on the Jocko K Canal Headworks and Fish Passage Irrigation Facility project. Just briefly, little background. This contract is specifically to procure materials to try to lock in costs. We will modify the contract for actual on-site construction at a later date. Funding for this phase is not settlement dollars, it is BIA Win Act dollars. Little bit of history quickly. Dan Lozar got your approval to accept these funds for the project in the past. The design work is 100% complete. We followed all the procurement policies using McMillan Jacobs, and it took 1.25 years to complete, all approved by council. We then selected Dick Anderson Construction for pre-construction and construction services following procurement procedures, and all of this was approved by council. The current contract is now moving from pre-construction to construction services. We have all the materials in place. Indian Preference Office has reviewed, LIS Appeal has reviewed, with contracts and grants, and the legal department has reviewed. So we are still working with the lands department. NRD and the lands department are coming together to begin to look at tribal lands that have materials that we can use in future projects for such endeavors as what I'm talking about today. So today, I respectfully ask the Tribal Council to approve the contract with Dick Anderson Construction in the amount of $1,352,131 to initiate the construction phase of work on the Jocko K Canal Headworks and Fish Passage Irrigation Facility. And that's why I'm here today, is because your staff, our staff, is out there in the field currently. So
Martin has a question, Rich?
No, Madam Chair, I had no question. I would just make the motion to enter in the contract with Dick Anderson Construction.
Okay, a motion by Martin. Do I have a second? Second by Mike. All those in favor? Ellie, I didn't get your vote. Okay, looks unanimous.
okay, thank you.
Carries.
Thank you, Madam Chair. I appreciate your time and have a great day.
Okay, actually, Lynn is gonna abstain, but motion carries. Thank you.
That is it for natural resources.
Thank you, Rich. Prayers to your mother-in-law. Okay, next up, we've got enrollment with Lawrence and Chastity, and they're up here. Good morning. Yes, Carol?
I just wanted to say to Chastity, I read the book, Brothers on Three, and I want to tell you, I feel like I know your family very, very well. It was a very good, well, it's an audiobook I was listening to, but I got through it in no time because I couldn't put my earphones down, but yeah, it was a very exciting book.
I appreciate it. Thank you.
First of all, Madam Chair, we'd like to bring forth a resolution on the December 1st per capita distribution. We're bringing it in about a week early because we have 2 holidays in November, and we worked out a time frame with accounting, and we determined that November 4th would be the cutoff date for the final list on the distribution for the December per capita. That gives them ample time to get in all the holds and everything and get everything transferred to accounting. We will notify the departments to start putting in their holds, so they'll have 30 days for them to put in their holds and get everything that is needed. We did make one correction into the resolution because we usually just put in for voluntary child support. But with the Child Enforcement Division taking the per capitas for child support involuntary, so we put in voluntary and involuntary child support. And I never thought about that before, that it was just voluntary, and everyone was taking funds out for even though it was not voluntary. So we got that into this resolution.
Thank you, Lawrence. So I'm looking for a motion to approve the resolution of the per capita distribution in December
So moved, Madam Chair.
2021. Martin, The motion, second by Bing. All those in favor? Unanimous? Motion carries.
What's next? Oh, this one. Yeah, I received a request from a individual called Manu Sporny. And he is working with Department of Homeland Security and other agencies in Canada and in the United States in regards to a digital ID. Now, the digital ID is an ID that you can download into your smartphone, and you could use it for getting on airplanes, because it has the code where you can just like when you buy a ticket from the airlines, you can just download it into your iPhone, and you walk through, and you don't have to carry paper with you all the time. And that's how this will be. And his working with Department of Homeland Security and developing their system, and wants to work with tribes so that we would fit into that system so that it meet the Homeland Security requirements for crossing internationally into Canada and from the United States into Canada, or United States into Mexico. We can do that right now, but we're not sure how long that's going to last before Department of Homeland Security wants us to upgrade our ID system. So it's at no cost to us. I was looking at some of the items that was being described between Jennifer and Chastity. This system is a grant system that he receives from the government, and it will end up being no cost to us to utilize him in this development. So there is no expenses associated with this. I would like to see if the council wants to start implementing a new system for Homeland Security.
Martin?
So if this person did this, I'm assuming they'd have access to enrollment numbers, date of birth, social security numbers. So how secure are we with this person and him protecting all of our, having all of our tribal members' information?
What I understand, Mr. Charlo, is that what he would do is design and develop the cards itself. We would then start implementing those features into that card. It's not going to be like the old system that we were looking at, where you push or pull, and they would have access to everything. We can develop this card so that it would show the necessary information, your name, address, and things like that. From what I understand, this one will not need to have a chip because it's coded.
I guess, Madam Chair, if I may. So I guess what would be our next step? I mean, are we to the point of agreeing to do this? Should we vet it a little bit more, maybe with, even have a legal look at it, to make sure that, we'd be protected? I think that minimum we should do that, so.
Yeah, what I wanted to do was I wanted him to be here to further explain his company. But when I got the notice of when we were on the agenda, and I emailed him, and so I emailed him this morning and telling him that, well, we're on the agenda at 10:30, 10:45, and I don't. it was just a little bit too short of a time. He is going to be here for a month. He's in Columbia Falls working on a project up there right now. And I could get him and maybe have him come in and give you an overview of his company and what it all entails at the next council meeting next week sometime. You know, and we can know exactly, and you could drill them a lot better because you'll have information in front of you and better understanding of, you know, how is this going to happen? Where is it going to happen? What do you need from us, and what do we expect from you?
Okay. Go ahead, Mike.
Thank you, Madam Chair. Have you presented this material to IT? I'd be interested in their opinion of it as well. IT.
Oh, IT. I haven't talked with IT. What I was going to do is send this information down to our IT out of Albuquerque. I never even thought about our IT here, but because IT that we use is out of Albuquerque for Teams. They're the developer of the system, and they own the system in which we get from them. And so I needed to get in touch with them.
Go ahead, Carol.
Yeah, you know, this is something I've been wanting to see us do for a while, but when we first learned about it, it was very costly. And I thought, wow, how could we ever, you know, that's when we didn't have much revenue coming in. And so I'm just curious if maybe we shouldn't look at a few companies. I mean, I don't know anything about this individual, and I don't want to, you know, give him a bad report or a good report. I just don't know. And so maybe we need to look at what options are available out there, and then also run it by legal on somebody that we want to get more information from. If it's this guy, do the due diligence on the background and all of that, because, you know, our information is pretty, you know, it's highly confidential, and we wouldn't want anybody to get in our system, but that's my thought.
Yeah, and we can do that. We can check to see if there's other companies. The reason why I was kind of receptive to this individual, because he has his foot in the door with DHS.
Okay.
And you know, and that's a hurdle that's a big hurdle to overcome, is DHS, because they start mandating certain items. If he's developing the system for DHS and is also developing the same system for us, they should match.
Yeah, and I'm wondering, did you go through the chain of command? I mean, did Rick? Okay, I'm just curious. I wasn't sure if you'd went that route, and he'd been okay with you presenting this individual. And
yeah, I will make sure that I will follow up to make sure that he does have.
Okay, probably should have went there first before it came in here, because we could have taken action today, and not having anybody within the chain of command following through on that. So.
What I'm looking for, Madam Chair and Council, is just a yes to it. Bring them in and have them do an overview to see if, you know, if that's something that we would like to proceed on.
Okay, Jen's got something here.
When I scheduled and Rick oversaw this, he saw that it was on here. He just knew that Lawrence was going to bring it in. There was no motion on it today. It was just to present. So Rick knew for the scheduling of this.
Yeah, so, it just has to be consensus that, you know, go ahead or don't.
Okay, so go ahead, Martin.
Madam Chair, I wouldn't be opposed to having the individual come in and give us a presentation. In the meantime, I would like to have legal kind of vet this a little bit for us. So if we could, I don't know if that would be just like be a consensus or a motion, but just have them review. They're good at just kind of just checking verifying things. So I'd appreciate if we did that in the meantime, and then we still can listen and hear them out. I mean, this is something that, yeah, we need to get into the digital age with this. Everything is digital now. So thank you. Okay.
Thank you, Martin. So you'll go ahead and get that to legal review then and have some correspondence with the individual and tell them that we are interested and.
Yep.
Okay. All right, thank you. Go ahead.
That's it, Madam Chair.
Okay,
Okay.
thank you. Have a great day. Okay, so we've got a request for a fire update that I think we're going to have real briefly before we go into the interview for the chief judge.
All right. SQX.
Good morning, Ron.
Hey. So I'll give you a brief update on the two larger fires that we have still staffed here on the reservations. The Boulder 2700 Road is currently an IC3 trainee by the name of Robert Dodson. He's been with us. He came with the incident management team, took some R&R and came back and filled the IC3 trainee position. We have a smoke jumper. His name is Tyson. He is the IC3 proper. Currently on that fire, it's minimal activity. They've had quite a bit of rain actually fall on their fire. There's still some heat up on top, but no real issue or concern. The main focus for that group is removing the slash that was created by the team as they progressed north and south, building a fuel break above the structures directly east of Highway 35. And so we've got the fuels crew up there working with them and our engine crew and a chipper. So they're feeding slash into a chipper and it's shooting it out into the forest land. So it's a very slow process. It sounds like we've got maybe a week left of doing that. A couple other things that are going on with the Boulder is VIA roads programs up there looking at repairing I think there was 8 culverts that were burnt. They're plastic culverts that were installed on the B2000 road. And so they've been working with our folks and inserting to try to get those fixed. Replaced actually. The Bear Fund project was funded and emergency stabilization on the Boulder 2700 road is going to be the priority. So Sean DeFrance is spearheading that effort and he's put out some contracts for bid and looking at getting some of those filled so that we can start, implementing some of that emergency stabilization work that we've identified or the Bear team identified as a need. Again, looking at debris flow and washout from the streams right there and how it's going to impact Highway 35 and things of that nature. So that one's progressing very well. It's going to wind down sharply. And then we'll start to look at rehab of all lines associated with that fire and be talking with, forest development and looking at some of the reforestation plans that they've got and try to coordinate some of that activities. It looks like we're going to try to plant some white bark pine up there on top where that fire hit, right on top of that bench on the upper portion of Boulder. The Crooks fire, currently staffed as incident commander type 3 is Robert McCrae. Robert's been there for a long time. That fire is 56 days old, I want to say. Art Trahan is the incident commander proper. They're still pretty heavily staffed. They have the Mission Valley fire crew, our type 2IA crews up there. And Chief Mountain is there as well, a type 1 crew from Browning. And this is their second role with us, and a lot of overhead from Oklahoma still in place helping, and probably 15 to 18 pieces of tribal Viper equipment still working that fire with engines, skidgens, feller bunchers, tenders, excavators, things of that nature. So we got stuff spread all around that fire. Since our last update, I'm going to say we have burned out. It would be the south side of that fire, the road and the lines from Whitehorse Lake all the way down to the mouth of Belmore Sloughs. And that went well. Everything's holding good, looks good. And today, the crew is looking to button up. We're going to put Daryl Claremont in our helicopter with Nick Mays, and we're going to go down and drop ping pong balls and some interior islands on the north facing slope, and use hand ignition with Chief Mountain and the Mission Valley crew to work. It looks like we're going to progress. Could be west to east or east to west. At any rate, looking to bring that fire all the way down to the river ahead of what looks to be a significant amount of rain that we'll have over the next 3 to 5 days. And I think that's going to do wonders in terms of locking up that fire. And then at that point, slash disposal is going to be one thing with the chipper. Probably move the chipper from Boulder and bring that over to Crooks and use the 2 crews to feed the chipper to get rid of that slash, and then look at moving other slash out of the area to a location where we could pile burn it at a later date. Outside of that, so, and possibly, you know, I know the biggest thing I've been getting calls on is when we're going to open up pieces of that landscape that we've locked down because of the fire. I think this rain and the work that they're doing today is going to go a long ways to opening up pieces of, you know, the Jocko Road, the road that goes up to the North Fork, maybe over to Sealy, and then at some point looking at the South Fork of the Jocko. So that's kind of where we're at. That's what's in our vision right now. And I guess I'll leave it to any questions or concerns.
Anyone have any questions for Ron? I know we're all looking forward to that rain this weekend, so I'm sure a lot of people are.
Yes. Yeah, there are a ton that are wanting this rain. It actually saw a little bit of snow up on top of North Crow today. It was nice.
Yeah, it's a beautiful day out there.
Madam Chair.
Go ahead, Martin.
Just want to make sure, like we always should do, Ron, thank you guys and your crews, and make sure that thank you from council extends down to everyone who works out there. You guys have done a great job this season. I know we're still got a few more weeks, but you know, I appreciate everything you guys have done protecting all the people, especially in where I grew up, you know, in Arley and the Jocko and everything. But yeah, you guys definitely did a great job. I know it was a very challenging season for you guys, but you know, great job. So thank you guys.
Thank you, Martin. Go ahead, Bing.
Thank you, Madam Chair. Say, Ron, no idea when you're going to open up the Jocko Road at all? Because I've had a lot of people ask me if that road is open, and I told them no. But they said, well, there's people up at Twin Lakes camping up there, so we thought maybe it was open. So then I heard that they were stopping traffic from going up that way. So I don't know whether it's open or closed going towards Twin Lakes. And I heard that somebody went up there the other night and got turned around there, you know, below the Twin Lakes Road there off Jocko there. So I don't know whether, like I said, I don't know whether it's open or closed. So just want to know if they had any idea when that would be open.
Yeah, that's something that I've been leaning on this team about. So it is open from the mission side, unfortunately, but not from the RLE side. So yeah, it's unfair to us, our legions. We can't go up there, but the mission side can, and we've been talking about that. We're trying to find some areas that would be ideal to open up. The Pistol Creek looks like that's going to be fine to open up hopefully before this weekend. Looking at narrowing that closure down to, where you turn to head up towards Twin Lakes across that Jocko Prairie area, maybe closing it from there to the Southport Gate. The things that we still have concerns with, we still have a lot of equipment up there. We just don't want vandalism to that equipment, and try to provide security to those folks and watch over their equipment since it's still under our control. And the Arley Rural Fire Department and Ronan Rural Fire Department have been standing up to help close those areas down. And I'm sure they're looking for a break as well. So yeah, we're all really looking towards this weather thing, and unfortunately it's going to happen on, a weekend. So it's going to be kind of clunky. We probably won't be able to get the word out if we do start opening things up, unless we maybe do it on our Facebook page or something of that nature. But I don't see us opening up everything all at once. Like I said, just kind of a strategic opening, still protect that equipment. And once we demob all that equipment out, and we just have a limited amount of equipment, we'll probably stage that at the Southport Gate. Maybe we'll have Jim Adams stage there so that he can ensure that that stuff's safe, and then look at opening up more area. The White Horse Lake, that Belmore area, just for safety of our public, I kind of see us keeping that closed for an extended period. But if this rain hits the way we think it's going to and shuts this season down like we hope it does, maybe the rest of the South Fork will become available shortly. So that's what we're looking for. And that's kind of what I anticipate. So it's not this weekend. Certainly we'll be talking with you on Tuesday and give you an update of what all has happened and what we're looking towards, if that meets council's wishes.
Okay.
Hey, Ron,
Sounds
just
good,
to
Ron.
follow up, did that fire go over top of, on the White Horse side down to the main road that goes to White Horse Lake?
Yep. Yeah, it did. Yeah, it's all the way from White Horse Lake all the way along that road. There's some areas that are cut off with hand line, and but all the way down to the mouth. So that whole side did receive some fire, and I think just how steep and rugged that particular piece of ground is. So that's where we got some concerns in terms of opening it up immediately to the public. Things are rolling out, rocks, snags are falling, things of that nature. So I kind of see us keeping that piece of the ground closed. We'll just have to take a closer look at where we think we can safely open up to the public. And again, I don't think we'll be staffing that closure. So it's going to be, dependent on our membership, just to, listen to our recommendations and just understand that there's a lot of risk and hazards out there.
Okay. Anything else for Ron?
All right.
Thanks, Ron.
Thank you, Ron.
Hey, have a good day.
Yeah, you too. Be safe. Okay, we got something real quick, update from Lawrence, and then we need to get to our interviews, questions.
Thank you, Madam Chair. Sorry, but when I changed that resolution for the per capita on voluntary, involuntary, there is a standing resolution that only allows 1/2 of a tribal members per capita to be used for child support. Council took action in March to allow DHRD to use all 400, but then they held off, and then in August they took all 400. I just need a clarification. Is that motion going to rescind that council resolution that only authorized 200? Or, you know, because we have that resolution in place and then a motion that authorizes them. Does that automatically rescind that resolution?
So I believe, Lawrence, that legal looked that policy over before it came in, that TSEP to change from the 200 to the 400. Do you know if Rhonda's available?
Yeah, it says everything before that date, they can continue taking the 400. Anything after that date is limited to 200.
Did you want me to just have them go up and see Rhonda? You can come back after the interview.
Yeah, maybe we can have you do that, Lawrence, if you'll
Okay.
go up and visit with Rhonda, because that went through legal before it came back into us and out to the public, so.
Yeah, okay, I can do that. I was just, you know, I'm in a dilemma with what's authorized and what's not authorized. Okay, thank you.
Thank you, Lawrence.
Madam Chair.
Go ahead, Martin.
Yeah, I bring it up because people do call me and say, how come they're taking all of my per capita?
Yeah, we've been getting some questions too. Thank you, Lawrence.
I'm sorry, I meant to do this during my announcement too. I just want to thank everybody that came to my district meeting last night. Michelle Morjo, Sandra Boham, Tom McDonald presented. Tribal Health was going to be there, but due to circumstances, they weren't. And then just everyone else that came, you know, Anita, Bing, Carol, Ellie, appreciate you guys being there, and everyone else out there that took time to watch it on Facebook. We'll be doing the next one next month. I can't do it on the second Wednesday, but I'm looking at different dates. So we'll definitely have one next month, and any topics that people want covered, go ahead and message them, email me, my cell phone, and I'll try to present those as well. So thank you.
Thank you, Martin.
Oh, and I'm sorry. Special thanks to Jen for getting the food. That was great. Malt Shop and Mission, some good Indian tacos. Thank you.
Hey, we didn't have Indian tacos, Jen. Thank you for your. Okay, so I believe that Ellie emailed you some questions that she threw together that we can. Yeah, yep. Okay, we'll go out of